Welcome back. If you're joining us for the first time, my name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, though I actually work with patients all over the world, thanks to telemedicine. And today we're going to be talking all about a naturopathic approach to perimenopause. And before I get into it, just want to make sure that if you haven't yet subscribed to our YouTube channel, I highly recommend that you subscribe so that you don't miss out on all the great content that we're putting out. And if you like the video, don't be shy, definitely like the video. And also feel free to leave a comment. I'm happy to answer any questions that you have regarding today's video. So let's just dive right on in. So first, what exactly is perimenopause? What and how would you know if you are in perimenopause? So when we're talking about perimenopause, what we're really talking about is the transition between our menstrual years and actual menopause. And menopause is when we no longer have a menstrual period for over a year. So we're talking about that period of time before absolute cessation of the menstrual period. Literally, perimenopause means around menopause. So normally, perimenopause begins anywhere in your 40s, but some people will actually experience perimenopause as early as the 30s. Typically, we characterize perimenopause as occurring about 8 to 10 years prior to actual menopause. So how do you even know? So that's like some of the timelines around perimenopause. How would you even know that you might be in perimenopause? So really the most common early signs of perimenopause is changes to your menstrual cycle. So we're not talking about like an isolated change once in a while, but a progressive change. So what are we looking at? We're looking at change in cycle length. So maybe you are someone who normally had a period every 28 days, and so you might be seeing more variation, whether it's shorter or longer. Also change in flow. So some people will experience a heavier flow, some will experience a lighter flow, but definitely a definitive change in flow. Also, the number of days that you bleed might change dramatically. And then lastly, change in PMS or premenstrual symptoms. So whether it's worsening, so worsening of mood changes, or maybe new mood changes, cramping, anything that seems very different from what you were normally experiencing could be a sign that you are in perimenopause. So what are some of the main symptoms of perimenopause? So first, I just mentioned definitely changes in the menstrual cycle, but some of the classic symptoms are really the symptoms that we often associate with menopause. So hot flashes, sexual changes, whether change in libido or increased pain, specifically usually due to vaginal dryness, change in cholesterol levels. It's not really a symptom, but that might be something that you might see in some blood work. Mood changes, not just around the menstrual cycle, but mood changes in general. Sleep changes, specifically, whether it's directly linked to hot flashes or problems with falling asleep, staying asleep, waking too early. This all can be a sign of perimenopause due to some of the hormonal changes that are occurring. And then lastly, changes in energy. So more fatigue can be occurring around perimenopause. So what do we do with the symptoms of perimenopause? So a lot of these interventions are very similar to interventions that I do during just in general menopause. So you can definitely also watch any of the videos on menopause. I have a great YouTube on all the supplements that I recommend. And if you don't yet have an account, I highly recommend that you get a Fullscript account, and I'll put that information in the video description, and if you establish an account with me, you'll get 10% off your first order. So let's go. So first, hot flashes. So this first supplement, basically I would recommend almost for all the other symptoms of menopause, maca, specifically gelatinized maca. So maca, also known as Peruvian ginseng, very effective for hot flashes. It has somewhat of a stimulatory effect on estrogen, though it is typically considered safe for patients that have maybe had estrogen specific cancer, and it's a very powerful tool in reducing hot flashes. And I've even seen it in my own practice with many patients experiencing dramatic improvement in just as few as 2 weeks. Another herb that's very effective is turkey rhubarb, and then lastly, I really also like ground flax and vitamin E, and interestingly enough, B12, specifically B12, can be very effective for hot flashes if there is deficiency. Libido and vaginal dryness. So a lot of this has to do with the decrease in hormones, and which causes not just changes in desire and arousal, but also has a big effect on vaginal tissue. So definitely going to bring back maca. I also really like ashwagandha. So ashwagandha has a powerful effect in helping with the male side of things, or the male hormones, specifically testosterone, and that can be really helpful for getting libido going. Vitamin E suppositories, really effective with the vaginal dryness. Vitamin E suppositories also can be helpful even during, after pregnancy, specifically for patients that are breastfeeding, because that can also have an effect on vaginal dryness. So, but vitamin E suppositories. And then I do often recommend by Biswecken, their suppositories. So they have a little bit of hormone in them. The one that I find to be most effective for vaginal dryness, specifically when there is an issue with hormones, is there one that has estriol, which is a form of estrogen, progesterone, and DHA. Very, very effective. I often will rotate between the Biswecken suppositories and the vitamin E suppositories. And then let's talk about mood and sleep. So for mood and sleep, definitely really important to get B vitamins on board, particularly B6. So B6 helps with the production of serotonin, and so modulating those levels. Magnesium, the magnesium that I really like in general for this population, it's by Vital Nutrients. They're triple magnesium. What I like it is because it has a couple different forms. It has glycinate, which is really helpful for mood, but it also has the malate form, which can help really with a lot of like muscle relaxation. So it's a really good one to have on, specifically if sleep is an issue. And then fish oil, and particularly I really like cod liver oil. And the reason I like cod liver oil is that in addition to the omega-3s, you also have vitamin D. So it's like a double for mood enhancement. So what are some of the tests that I would recommend in regards to perimenopause? So as far as kind of like diagnosing perimenopause, the best test really to do would be a day 3 FSH. FSH is follicle stimulating hormone, and it is an indirect marker of ovarian reserve. So FSH is produced in the pituitary gland, and it stimulates the ovaries to start that process of releasing an egg. It's not LH, which is luteinizing hormone, that actually triggers ovulation, but it is what is kind of like telling the ovaries that it's time to make an egg, and it works on a negative feedback loop. So the more FSH you have, meaning that the ovaries need more support stimulating. So basically, the higher the FSH, One, we're seeing poor ovarian reserve. So basically for women that have an FSH over 10 is typically defined as poor ovarian reserve, and this is really a marker that they use when it comes to things like IVF, for example. And then FSH above 30 is typically indicative of perimenopause. So that's the one of the defining tests. Then other things that I look at as a naturopath, specifically either we know that you're in perimenopause or we at least suspect that perimenopause will be around the corner, I highly recommend doing a Dutch test. And so the Dutch test looks at our luteal phase hormones. So these are all our estrogen and progesterone, and also our male hormones or our androgens, things like testosterone and DHA, and how they are behaving during the luteal phase, which is everything that happens after ovulation. So I want to see like where those hormones are landing. But we're also looking at adrenal health and adrenal hormones, and that's very crucial, specifically because perimenopause is going to lead to menopause, and during menopause our adrenal glands kind of take over when it comes to the hormone production, as opposed to the ovaries that are much more characteristic of what is being produced during the menstrual years. And so I like seeing where our adrenal glands are and what we can be doing to support the adrenal glands to make sure that the transition to menopause goes as smoothly as possible. The other part of the Dutch test that I like is we also look at neurotransmitters, and so neurotransmitters are really important for mood regulation. So it's just something else to consider as a patient is transitioning eventually into menopause. Also definitely want to look at thyroid. So even if you were someone who never had problems with your thyroid, entering menopause can have a big effect on thyroid function. So I definitely want to look at thyroid in a complete panel. So not just looking at thyroid stimulating hormone, but looking also at T4 and T3, T3 being your more active thyroid hormone, T4 less active, and then other markers such as anti-TPO and anti-TG, which are thyroid autoantibodies. These can definitely also increase during the perimenopause and menopausal years. And then lastly, looking at specific metabolic markers, things like hemoglobin A1C, which is a marker for prediabetes, and also a lipid panel, which looks at cholesterol and triglycerides. And this is more just, again, to kind of like look at the status, your status as you transition into menopause. So I know that was a lot, and I hopefully you found that helpful. And don't feel shy. If you like this video, don't forget to like it, and also definitely feel free to leave me a comment in the chat, and also subscribe to my YouTube channel. And lastly, anything that you heard about supplement wise that I've recommended, I'm gonna also make sure I'll have some links to some of the products that I prescribe to my patients, and you can create an account using my link on my Fullscript. So that was, in a nutshell, perimenopause, and my name again is Dr. Branin, and I look forward to seeing you next time. Take care.